Hi everyone, I'm Michael Uriarty or Dr. Mike, and welcome to Technique Talk, the MYK System, and more. This is episode 8 in our series of comparing and contrasting other techniques with the MYK System. Today, we're going to talk about Chiropractic BioPhysics, also known as CBP. If you want more information on either technique, I have the website links in the description below. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. What is Chiropractic BioPhysics? Chiropractic BioPhysics was founded by Dr. Donald Harrison in the 1980s. When he was younger, his family and friends called him Deed. Don hurt his back, and after struggling with a back injury for a while, he finally went and saw a chiropractor. He was so impressed with how quickly he got better that he wanted to become a chiropractor as well. He graduated from Western States Chiropractic College in 1979. He worked with Dan Murphy out in California for about 6 years. Now, Dan is a big-time educator in the field of chiropractic. He knows his stuff. If you ever get a chance to go hear him, I would go. In 1993, Don went back to school and got his master's in mechanical engineering. He was high up with the International Chiropractic Association and an extension faculty member of a few chiropractic colleges. Don was passionate about integrating chiropractic care with the principles of physics and biomechanics. He aimed to develop a system that not only addressed immediate pain relief, but also corrected the underlying structural issues that caused chronic pain and health problems. Don's biggest achievement was putting together the technique Chiropractic BioPhysics, or CBP. Speaking of big achievements, let me give you another piece of how we came up with the MYK system. In the early 90s, only about 10% of the chiropractors worked with soft tissue. I opened up my office with 5 massage therapists and myself, so I was definitely out on the fringes at that time. I saw the benefit of working with soft tissue, and I had this idea of putting a technique together that would bring the chiropractic and massage professions together. Earlier, I said that if you get an opportunity to go hear Dan Murphy talk, you should go. Well, I went to a talk that he was giving at Cleveland Chiropractic College, and it was about how does a chiropractor help someone with an adjustment. And he was explaining about pain receptors and movement receptors, and I'm not going to bore you with that talk, but basically he said that if we can get the movement receptors to fire, this will override the pain receptors, so when a chiropractor moves a bone, this helps reduce pain from these receptors. This is just one step of the process, but it is a step in the process of pain relief. On the break, everybody left. It was like lunchtime. Everybody left, and it was just he and I in the room. And so I went up to him and I said, "Hey, Doc," and because I was thinking about this technique, and I said, "Hey, you didn't say anything about the muscles, but if I were to move the muscles and not the bone, could I get those movement receptors to fire?" And so we talked and everything. He came back, and when everybody came back from lunch and from the break, he told everybody, he stood up and he goes, I had this guy come up and ask me this question about the muscles. He goes, now that guy was thinking. We as chiropractors forget about this other system, the muscular system, and it's huge. And I turned to my buddy and I go, that was me. And my buddy goes, you're a moron. I go, yeah, I know. I'm a moron. But I go, that was me. He was talking about me. Anyway, so I went home and I looked at, I started looking at, where are these pain receptors and movement receptors? And basically they're everywhere. They're in every single muscle, tendon, ligament, joint, bone, everywhere. And so with the MYK system, that's what we're doing is we're going to move or put some movement into, and this is, again, just one little aspect, but we're going to put movement into every single muscle, tendon, ligament, joint, bone on one nerve pathway. And I do think that's why we get better results and faster results than when I just adjust alone, because I'm hitting more movement receptors on that nerve pathway. That's just one aspect. All right, let's look at theory and philosophy. What is the theory and philosophy of CBP? CBP looks at the curves of the spine from the side view. They call this the Harrison spinal model. The cervical spine, if you were to draw a circle, the cervical spine would line up on a piece of that circle. Say a quarter of the circle or an eighth of the circle. And CBP, they call this the cervical circular model. The thoracic and the lumbar spines would line up on a piece of an oval shape, meaning they're not quite as bent as a circle. They're a little bit straighter, and so the line is more of an oval shape instead of a circular shape, compared to the cervical spine. So the low back, they call that the lumbar elliptical model. The core philosophy of CBP is that the spinal misalignments can lead to nerve interference, which in turn affects the body's ability to function properly. Let me say that one more time. The core philosophy of CBP is that spinal misalignments can lead to nerve interference, which in turn affects the body's ability to function properly. By correcting these misalignments and restoring the spine's natural curves, CBP aims to improve nervous system function and overall health. So CBP practitioners use x-rays and postural analysis to identify spinal misalignments and deviations from the ideal spinal model. Then they create a customized treatment plan that probably will include spinal adjustments, then may include corrective exercises and traction to realign the spine and improve the posture. It looks like, because they have some graphs and stuff up, it looks like they're going to compare the head to the rib cage to the pelvis, and they're looking for rotations and or translations. So they're either moving or rotating or, whatever they're doing. And so then they're going to do what they term mirror image adjusting. So basically, like if your head is rotated this way, rotated to the right, then they're going to rotate your head to the left to adjust and things like that. So it's going to be the mirror opposite and do the adjustment. So we'll dive deeper into the adjusting procedure and the exercises under What Does a Practitioner Do? Now, the theory and the philosophy of the MYK system. The MYK system is a global assessment and treatment protocol used to bring the body back into allostasis by correcting postural imbalances. Ooh, I just used a big word. Okay, so allostasis. Now, I'm going to use another big word so that I can explain all this, and I'm going to say homeostasis. So homeostasis means everything is in balance. So the posture is balanced, which means the nervous system is balanced. This is if we're in homeostasis. The posture is balanced, the nervous system is balanced, which means the body is functioning the way it's supposed to function. Allostasis is the journey from where you are right now and getting to homeostasis. So with each treatment, we're putting you in a better state of allostasis, working towards homeostasis, if that makes sense. So I keep trying to provide different areas of what we're doing as far as theory and philosophy. So watch some of the other videos on YouTube or listen to some of the other podcasts to get a clearer picture of the full theory and the philosophy of the MYK system. All right, so now we're going to look at what can CBP help with? What do they say that they can help with? So CBP is designed to help with a variety of conditions. This is from their website, including chronic neck and back pain, poor posture, scoliosis, headaches and migraines, sciatica, herniations, disc herniations, sports injuries. So the goal is not to just provide symptomatic relief, but to address the root cause of these issues by correcting spinal misalignments. Now, I like that part of it because that's what we're trying to do with the MYK system as well, was we're trying to get to the root cause of the nervous system dysfunction in what's going on with the person. So we don't want to just get rid of the symptoms either. We're trying to fix the nervous system, balance the nervous system. So I do like what they're saying right there. So we're going to be pretty close on what we say we help. One difference is with the MYK system, since we're not moving bones, we've helped with symptoms from scoliosis, but we've never corrected scoliosis because we're not moving bones. We're 100% soft tissue. And so that's one thing that I don't put on the list that we can help. We've helped with the symptoms of it, but I don't say that we're going to help, align a scoliotic spine. So, all right. What does the practitioner do? So a CBP doctor will do an exam, which includes taking x-rays. The care begins with 12 visits, 4 times a week for 3 weeks. They call this relief care. And you can use any chiropractic adjusting technique to accomplish this. So CBP doesn't have a specific technique. They developed the assessment portion and the rehab portion, but they didn't develop a technique per se on how to adjust. So once you complete the initial 12 visits, you start the CBP structural rehab phase, which includes mirror image exercises, adjustments, and traction. And so they call this EAT, the EAT, the exercise, adjustment, and traction, EAT. I like it. Good job on the acronym CBP. I really do like that. So, all right, you should go to their website, and under what is CBP, they have pictures of this mirror image exercises and traction. And some of the pictures, personally, I don't think my body could handle it. One of the pictures, the person's head is going all the way back, and my body would not be able to do that. But maybe if they fixed me first, if I went through the first 12 visits and they fixed me first, then I would be able to handle that. It just looks, it looks like, ooh, you got to look at the pictures. So go to the website and check out the pictures on that. So, all right, to summarize this. So based on the assessment, they developed they're going to develop a personalized treatment plan that includes adjustments, spinal adjustments to correct the misalignments, traction to remodel the spine and restore proper curves, exercises to strengthen the muscles supporting the spine, and then education on maintaining good posture and spinal health. Regular follow-up assessments are conducted to monitor progress and adjust the treatment plan as needed. With the MYK system, we don't do x-rays. The treatment is 100% soft tissue, and we're treating only the muscles innervated by one nerve root. The person stays fully clothed. There's no oils and creams. The treatments are anywhere from 3 to 15 minutes, depending on the nerve level that you're treating. We don't do spinal adjustments nor traction, but we do have specific exercises based off the postural imbalances that we found and the specific nerve level that the person has. All right, let's do a summary of the similarities and the differences of CBP and the MYK system. So similarities, a holistic approach. Both the MYK system and CBP take a holistic approach to health, aiming to treat the root cause of issues rather than just alleviating the symptoms. Customized treatment plans. Both systems emphasize the importance of personalized treatment plans based on individual assessments, and then a focus on alignment. So both techniques recognize the importance of proper alignment for optimal health. CBP looks at the spine. The MYK system looks at the posture. Now, some differences. Just in the foundational principle, CBP is based on biomechanics and physics, with an emphasis on spinal alignment. The MYK system focuses on postural imbalances, the muscular system, and the specific nerve levels needed to bring the body back into balance. Another difference is the techniques used. CBP involves specific spinal adjustments, traction, and exercises, I would rather use their term and go exercises, adjustments, and traction, which is then EAT. I like it. All right, but then the MYK system, we incorporate movement, both passive and active, on each muscle along one nerve pathway, along with specific exercises to help balance the posture. And the assessment methods are different as well. So CBP is going to rely more on x-rays for the assessment, while the MYK system is going to rely on finding big postural imbalances from side to side and relating this back to the nervous system to determine which treatment needs to be done. So in conclusion, both Chiropractic BioPhysics and the MYK system offer unique approaches to improving health and addressing pain. If you're a patient or a practitioner, understanding these differences and similarities can help you choose the best approach for your needs. For more information on either technique, check out the links in the description below. If you haven't done it yet, be sure to hit the subscribe or the follow button. Thanks for tuning in. If you made it this far, smile.